A client with diabetes reports feeling shaky, anxious, and sweaty. The nurse should first A. Check blood glucose. B. Give insulin. C. Call the doctor. D. Administer glucagon. Answer: A. Check blood glucose. Which vaccine is safe to give during pregnancy? A. MMR, varicella, C. Influenza, inactivated. D. HPV. Answer: C. Influenza, inactivated. What is the normal range for sodium? A. 135 to 145 Mg, Lb 120 to 130 Mg, Lc 140 to 160 Mcq, Ld 125 to 135 Mcq, L. Answer: A. 135 to 145 Mcq, L. A nurse is caring for a client with heart failure. Which finding should be reported immediately? A. 2+ pedal edema. B. Weight gain of 3 pounds in 24 hours. C. Mild shortness of breath. D. Fatigue with activity. Answer: B. Weight gain of 3 pounds in 24 hours. What position is best for a client receiving tube feeding to prevent aspiration? A. Supine. B. Left side lying. C. High Fowlers. D. Trendelenburg. Answer: C. High Fowlers. A patient is on a heparin infusion. What lab should be monitored? A. INRB platelets. C. APTT. D. Bun. Answer: C. APTT. A toddler ingests toilet cleaner. What is the nurse's first action? A. Induce vomiting. B. Call poison control. C. Give milk. D. Start CPR. Answer: B. Call poison control. A nurse is caring for a client with a chest tube. What is the priority action if the chest tube disconnects from the drainage system? A. Clamp the tube immediately. B. Call the physician. C. Apply an occlusive dressing. D. Place the end of the tube in sterile water. Answer: D. Place the end of the tube in sterile water. Which of the following foods should be avoided in a client taking warfarin? A. Broccoli. B. Carrots. C. Chicken. D. Apples. Answer: A. Broccoli. The primary purpose of administering magnesium sulfate in a pregnant woman with preeclampsia is to A. Lower blood pressure. B. Prevent seizures. C. Increase urine output. D. Stop uterine contractions. Answer: B. Prevent seizures. A client with COPD is receiving oxygen at 6 L per minute via nasal cannula. The nurse should A. Continue as prescribed. B. N. Notify the provider immediately. C. Switch to a face mask. D. Lower to 2 L per minute. Answer: B. Lower to 2 L per minute. Which assessment is most concerning in a client receiving IV potassium? A. Burning at the IV site. B. Flat T waves on ECG. C. Muscle cramps. D. Peaked T waves. Answer: D. Peaked T waves. Which patient is most at risk for hyperkalemia? A. Patient taking spironolactone. B. Patient on furosemide. C. Patient with chronic kidney disease. D. Patient on ACE inhibitors. Answer: B. Patient on furosemide. A patient with pneumonia is placed on airborne precautions. This action is A. Appropriate. B. Against guidelines. C. Not needed. D. Only for TB. Answer: C. Not needed. A patient with pneumonia is. What is the priority when administering digoxin? A. Monitor respiratory rate. B. Assess blood pressure. C. Check apical pulse. D. Assess bowel sounds. Answer: C. Check apical pulse. Which condition is most associated with a positive Trousseau sign? A. Hyperkalemia. B. Hypomagnesemia. C. Hyponatremia. D. Hypercalcemia. Answer: D. Hypercalcemia. The nurse is caring for a patient with neutropenia. Which precaution is most important? A. Bleeding precaution. B. Fall risk prevention. C. Infection prevention. D. Seizure precaution. Answer: C. Infection prevention. A patient is receiving morphine. What is the most important to monitor? A. Respiratory rate. B. Blood pressure. C. Heart rate. D. Temperature. Answer: A. Respiratory rate. Which of the following is a sign of lithium toxicity? A. Constipation. B. Polyuria. C. Slurred speech. D. Headache. Answer: C. Slurred speech. Which client statement indicates understanding of phenytoin therapy? A. I can stop taking it once I feel better. B. I will take it only when I have seizures. C. I can drink alcohol occasionally. D. Lee have regular dental checkups. Answer: D. I have regular dental checkups.